Welcome, everybody, to Health Advocate X's community conversation for the month of April. I am your host, Dr. Melinda Stewart, and this month we are talking about something that is near and dear to my heart, autism. And I am so excited to have Lonnie with us today to have a really robust, amazing conversation. I've loved the conversations that we've had leading into this, and I know that today's going to be amazing. So, Lonnie, if you want to do a little bit of an introduction and get this started.
Of course. Thank you so much, Melinda. And thank you everyone who has taken time out of their day to join us. We're really happy to be here with you. My name is Lonnie Riley. I am by professional training an occupational therapist and have focused my practice over the past 25 years. I think this is my 25th or 26th year in practice. I guess it's my 26th in pediatrics. And so, with that practice comes a lot of, concern from parents and families about child development and children's, meeting their developmental milestones. And with those concerns, sometimes comes a diagnosis of autism. So, we're here to talk about my experience with kids and families across time and what various autism journeys have looked and felt like, from my perspective as an OT. And Melinda, I know that this is a really important topic for you as well, and I'm very excited to kind of talk about what the lifespan looks like. And yeah, we could talk all day, honestly, but we'll try to we'll try to keep you for the slated hour. So that's me. And again, thank you so much for having me here. Oh, and also I'm a new board member here at Health Advocate X. I should not forget to mention that. So yeah.
I always forget to mention that, so I get it. So yeah, this is personal for me. I'm a late diagnosed. I have, I think the technical term is ADHD. So I'm a little bit of both and a little bit of the things. And I didn't know until much later on, but we'll talk about adult diagnosis later. So let's start with, especially since you're working with the pediatric side, you know, maybe start with what is this? What is autism? What is this neurodiversity that we're actually talking about?
Right. So, there are so many things that, come into play when you're talking about autism. When we think about it from, a clinical diagnosis, we think of it actually primarily as a pragmatic language disorder. That's one big part of autism that people take a look at. And then, another piece that kind of is always present with an autism diagnosis are sensory differences. So we see that, children who have a diagnosis of autism will present with sensory and perception differences. And, we'll get into this a little bit more, but these quote deficits, and I'm putting quote around deficits because, that's a clinical kind of term, right? These can also be assets to any person. Um, and I think what we want to know is that, what are the support needs that any particular individual requires to help them access, right, their activities of daily living. And, just to back that up for a moment, that's what occupational therapy is really charged with, is helping the client, whether they have a diagnosis of autism or ADHD or, medical diagnosis, maybe of cerebral palsy, whatever the diagnosis is, OT is meant to support the needs of the person in accessing the activities that are meaningful and important to them across their day. So, like any diagnosis, autism might be the person who is autistic might have kind of higher support needs around a certain area of function, or might be quite independent with another area of function. So it's really individual, and just wanted to kind of start off with that level set.
And I love the fact that you're talking about, how much need. Top, often we hear about high functioning and low functioning or on the spectrum, like it's a continuum. Can you talk about that older language that we used and what some of the newer, more revised languages now?
Sure. And I think it also, is important when we talk about any person who has any diagnosis, we want to ask them, how does it feel for you when, this particular type of language is used or this other type of language? You know, what do you want me to say? How do you want me to refer to, what your need is, and that kind of thing. So with that said, high functioning and low functioning really is old school, as it were, right? So, I think what I mentioned a moment ago is that we all have areas of need relative to areas of strength. Every single person does, neurodivergent or again, neurotypical in air quotes, right? So that's what we like to talk about is, what is the support need for this individual? Do they need higher support in, for example, managing their daily routines? Are they independent with their daily routines, but maybe they need higher support in terms of, managing their social connections? So it really is, again, Melinda, individual to the person. But that's what we like to try to discover when we're working with a person who is autistic is, what is their level of need relative to their kind of level of strength, and then, help in whatever way we can based on, that support need. So I hope that's helpful. I think high functioning and low functioning are pretty much out at this point in time.
Yeah, I completely agree. And with this, I love the point that you made about asking people how they identify, right? We hear so often people talk about, the autistic person versus a person with autism. And, whether that's identity first language or person first language, some people have different feelings about that. And I know within the community, you're going to have individuals that do identify with that first, and other people use well, I have. So allowing people to kind of own that and give you the language, I think is super important. And as you mentioned, the spectrum isn't a continuum. And that's for people that are new to this conversation. We often think about it as like, oh, well, it's a spectrum and it's this way. But I really like the imagery of the spectrum being this beautiful color and it's got all of these different kind of spokes coming off of it. Because if you meet one person who's autistic, congratulations, you've met one person who's autistic. Because all of us are we have different needs, different things that make us who we are. So, as a advocate for this, I really love the idea of celebrating minds of all kinds and just letting people kind of be who they are and, supporting them the way that they need. Now, I assume that those needs are going to look different when we're working with kiddos versus working with adults. Do you want to talk about that journey a little bit for us?
Yeah, absolutely. And, you're right, because when we think of, a diagnosis occurring in early childhood, that's going to look quite different from a diagnosis that occurs, in even middle childhood or, in a young adult or adult. So, my primary experience from, an OT point of view is really working with families as they're beginning to have concerns for their child's development, are curious and concerned about what's happening and maybe why their child isn't, able to access language, isn't able to play with their peers, isn't able to follow, daily routines of the family and that sort of thing. So that's, where I have come into the journey, is right at the beginning, which for me has been a blessing, because when you're able to support a family in that time, I mean, there's nothing like it, honestly. I have had parents come to me who, have known for, even before they got their diagnosis that something was different, with their child. And, they knew that they needed support and kind of came proactively looking for it. I've supported families who, you know, really didn't want to hear that there was anything different going on with their child. And so those support journeys look different too, right? Like, so even in those um, early years, one journey is not the same as another journey. This is a repeated theme, isn't it, Melinda? Like, it's never the same. It's always individual. Um, so, I think just to kind of give a background from my perspective in terms of how, a family might come into care. Again, maybe a family has concerns about their child's development and they're not sure who they should speak to first. Um, there are a couple ways that I see families most commonly come to me, and one is either through their medical doctor, and another is through somehow through a teacher or an educational side of the house, right? So if a child comes to me and their doctor has said, referring to OT for, let's say, motor coordination difficulties. Maybe the family's like, oh gosh, my child isn't, meeting their motor milestones on time, and I don't know what that means. I might see that child and I might think to myself after doing an assessment, oh, you know what? Okay, yep, there are concerns about motor milestones here. I can see that clearly. But I'm also noticing that there might be, you know, some signs that point to a diagnosis of autism. And at that point, as an OT, I'll call up, my colleagues that are actual, that diagnose. So I am not a diagnostician, but a developmental behavioral pediatrician might be somebody that I would refer to, or clinical psychologist is somebody that I might refer to, and help that family to understand why I'm making that referral, right? So this is definitely part of like the support role and also the advocacy role is, hey, I'm your OT. I'm seeing, these things, and I'm also seeing some concerning, signs that we might want to investigate further. Let me help you to get to where you need to get so that we can then take the next step, right? So, the other way I see kids come to me is they do have a diagnosis already, and they, may have gotten a diagnosis, as I mentioned, from like a developmental behavioral pediatrician. That's probably for me the most common. There's not necessarily the same route in every state, but in my area in California, we have a few places where there are developmental behavioral pediatricians that will, provide a diagnosis. And then, we work as a team to kind of identify, what is this child going to benefit the most in terms of a plan of care and move forward from there. So, that's kind of the nutshell version of how a young child might be diagnosed. We still see that median age of 4.5 for the diagnosis of autism, which is actually later than we'd like to see it. And it hasn't really moved too much in the past couple of decades. The earlier we provide support, and especially if the support is provided thoughtfully and appropriately, the outcomes are much better, right? Later down the road, especially if you have a little person who is, needing a lot of support right at the get-go with like sensory differences and language help and that sort of thing. Gosh, again, I could go on and on, but I know we want to get to, what does the journey look like maybe for an adult, and, how do we then take the next steps? So I'll just say a couple more things about post, maybe early diagnosis. Again, we're going to establish a plan of care. We're going to want to make sure that everybody on the team is really dialed in and really consistent with what's happening for that child. So if it's, a child who's under 3, we might be engaging early intervention services. And those are different across each state. Here in California, we have something called regional centers that provide care to that kind of early intervention age. But once you're a regional center client, you're a regional center client for life. So that kind of comes back into play a little bit later down the road in the journey. And then, once the child is 3 and we're starting to seek services, that service is then provided through the school system. So we'll want to have that child then evaluated by a preschool assessment team to be to assess whether the child is eligible for special education services and under, maybe an autism diagnostic criteria. So that would be kind of the next step. And I'll pause for a moment because I know I'm saying a lot and I see some chat coming in and I want to acknowledge that as well.
Yep, I just was gonna ask you to pause for just a second because we do have a great question from Scott about how do these kiddos and adults get diagnosed? What is the process for getting diagnosed?
Oh, yep. Great. Thank you so much. That's a really great question. So there are standard of care assessments, and again, as an OT, I'm not a diagnostician, but my colleagues who are diagnosticians will use some of these gold standard evaluation protocols. One of them is called the ADOS. I don't know if that sounds familiar to you, Scott. It is a diagnostic set of criteria that looks at several different domains, including social communication, play skills, sensory skills, and it's quite a battery. But one of my very close colleagues who I've observed giving the ADOS number of times, if you're a great practitioner, I have to say, if you're a great practitioner, you make that whole thing look like a play session. So that the child is, as comfortable and relaxed as they can be, because, these clinical protocols can be quite off-putting, even if it's just, you going into an assessment. It can be off-putting if you don't make it meaningful to the child. So there are gold standard kind of autism assessment rating scales that are generally used to make the diagnosis. Blood testing is not done to make a diagnosis of autism. Sometimes, though, if there's a developmental behavioral pediatrician who makes a diagnosis and they're concerned about maybe other genetic considerations, they'll send a child for blood testing and genetic testing to rule out things like Fragile X is one that comes to mind, that can, look a lot like an autism diagnosis at face value. But then if it's not, you'll want to send that child, for genetic testing as well to rule out or rule in. Is that helpful?
Having a problem getting my mute thing off. Thank you.
Yeah, no worries. Okay, great.
So there was one additional part to that question is like, if it's not autism, what are some other possibilities? I know I mentioned I have, as I call it, touch of the tism, um, that that I was diagnosed when I was, like I said, I was my late 30s, and I had a conversation with my therapist, and she was like, "Oh yeah, that's because of this." And I went, "What do you mean, just oh yeah?" But I had presented enough things that in our conversations over the years that she had assumed I had already been diagnosed and that I knew, and I didn't. And then I did a lot more research in autism and ADHD. But when we talk about neurodiversity, it is quite the umbrella. This can include Tourette's, this can include dyspraxia, like there's all sorts of different things that this can include. Do you want to talk a little bit more about what might be included if we're looking at it, even maybe with a child, if it's not autism, what are some of the other opportunities that it could be?
Yeah, for sure. Again, please take this with, the knowledge that I am not a diagnostician, but I do have, the number of clinical years of observation that I have. So one thing that I'd like to say is that autism always has a sensory differences component attached to that diagnosis. But you can have sensory differences without the rest of the criteria that have you meet a diagnosis of autism, if that makes sense. So you can have the component that is sensory differences without, for example, the language differences that are essentially required to meet an autism diagnosis. So that's something that I've seen very, very often in my practice is, a family will come in and they'll say, gosh, we have all these concerns about, my child's ability to tolerate clothing texture. They're a very picky eater. They don't like loud sounds. And the list goes on of the sensory differences. But because they don't meet the other diagnostic criteria of autism, and we can actually put some resources in there if you're, wondering about that, what specifically those other diagnostic criteria are, they might just be a child who has sensory processing disorder, right? And so then you kind of come at it from that angle, which is, thinking that this child probably will have, the ability to process language maybe at a little bit of a higher level than a child who also has an autism diagnosis that might have a language component tied to it. I mean, there's so many different combinations of things. But Melinda, you also just mentioned something, that many times goes along with a diagnosis of autism, which is dyspraxia. So that is, differences in motor coordination and the ability to ideate and then initiate and then carry out a motor plan. And some folks are just dyspraxic and, actually do pretty well with their sensory processing and don't have the language and pragmatics component, but they're dyspraxic, right? So it really is kind of putting together like the pieces of a puzzle to kind of figure out like, okay, does this child or person meet all of the diagnostic criteria? Or are there components that we're pulling out that really means this person has, just a dyspraxia diagnosis? The other thing to think about is, there are co-occurring conditions that come along with autism, and, that can sometimes also be something that is needed to be differentiated away from, just the diagnosis of autism, but we can get there later on. Hopefully that's helpful. Again, a lot of possibilities out there. We're all built very differently. Our neurologies are all different from one another.
Yep. And
Yeah.
that's why we just celebrate minds of all kinds and help people where they meet them where they are and do the best we can. And if we can all just do that, we're starting off on, on a creating an inclusive environment, and that's going to be what we need to do. So, as you had mentioned, there really truly there is so much to unpack this. So I hope we're giving you a good foundation to start with. So let's build from there. And what are some of the needs from a medical need, medical side of things that we're going to need to take into consideration when working with autistic patients?
Oh gosh, yes. There are, again, oh boy, it's like I'm a broken record, Melinda. It's going to be individual for each client. And, as we're thinking about building a plan of care for a person who has been diagnosed with autism, we do really want to take into consideration, there are other surrounding medical needs. And especially as advocates, it's really important if you're working with a patient that's able to report directly about their health history, please make sure to talk about that at length. If you're working with a person who, needs the support of their caregiver to provide you with that information, please have that conversation, because, there are a lot of things to look out for. There are diet and feeding and eating considerations to think about, because these systems of our autistic community are, uh-oh, I froze, I'm sorry. The systems of our, of our individuals who are diagnosed with autism can be very sensitive. So there are some people that really need to think about, food sensitivities or food allergies and make a plan to keep their gut biome as healthy as possible. There are, many times there can be a child who's diagnosed with autism, but then, as they're entering puberty or even a little bit later than that, can then have a co-occurring seizure disorder. So that's something to really look for. It's more common than you might think, for a child who's looked seizure free for, the majority of their elementary school, middle school lives to then in, high school or early adulthood develop a seizure disorder. So that's something that you want to kind of keep in mind, especially if you're working with somebody across a span of time. And then there might be co-occurring mental health conditions that you really want to pay close attention to. People who have a diagnosis of autism are more likely statistically to develop anxiety and depression. Anxiety is something that can really interfere with someone's ability to even go to a doctor. Speaking of medical needs, I can think of several clients that because our medical facilities are so calming and chilled out, right? That's a really hard hurdle to overcome, is even getting into the doctor for a visit because it's so anxiety provoking. So, there are a lot of concerns that, you really want to know, if you're advocating for a person who is autistic, ask them, ask their caregiver if they need help to, tell you about it. Anything that comes to mind for you, Melinda?
Well, I was just going to say the point that you just made is so incredibly important that, and I'm a firm believer that, this diagnosis is not a disability, but environments are disabling.
Mhm.
So I'm not disabled, but in certain environments, the environment becomes what's disabling. So I can't deal with loud, chaotic noises. So being in an environment that I know is going to be very loud and chaotic, as an advocate, if I'm working with somebody who shares that, I can do certain things to maybe work on the front end and be like, hey, is there a quieter space that we could sit and wait while we're waiting on that provider? Or if fluorescent lights are an issue, because it's not that our the ways that our brains are working is the disabling part. It's the environment that is not working and conducive for what we need. So I always think it's such an important thing that we as advocates, as patients, as loved ones, as caregivers, as whatever label we are, when we know that somebody, diagnosed or not, is facing these things, stupid train. I hope y'all can't hear that.
Okay.
But okay, good. There's a train. It's annoying. I digress. But diagnosed or not, if we're noticing these characteristics coming out, what can we do as caregivers to kind of help in that situation? So whether it's finding a different place, letting that patient know, that client know that if there are needs that are needed, that we can help them with that. Um, so yeah, I think that's an important aspect to bring up.
Yeah, it is. And, I want to say something that is also kind of acknowledging parents who have children who are diagnosed with autism that have the highest support needs of this particular group of people. I have folks whose, children are diagnosed, and despite, the best and most intentional treatment plans, still have, you know, very high support needs in terms of behaviors, very high support needs in terms of communication, very high support needs in terms of, feeling well. And when you have difficulty or no speech, right? If you're non-speaking and you don't feel well all the time, then you do see a lot of behaviors that are hard to manage. And I think that is kind of the group within this group of people who do probably experience autism more as a disability, because they really are hindered from participation, right? Because, again, the behaviors can be so extreme based on the communication being so limited. And sometimes, this is another thing that comes along, not always, but sometimes with a diagnosis of autism is a diagnosis of intellectual disability. And so then also, if you don't have kind of the problem solving ability without the support of somebody to help you problem solve, like that's kind of a perfect storm where this condition can be quite disabling. And I want to acknowledge that because, I definitely have a subset of parents that are going to have their child with them for the majority of their life because they're dealing with things that are very, very difficult, right? So, and then this is why it's such an important thing to remember that, you might see a person out there in the world who is struggling with, self-injurious behaviors or like heavy amounts of repetitive and rigid behavior, which is part of the criteria, right? And then you might see somebody that you're like, oh, wait, you're autistic? I didn't know that. How, and ask a question like, thanks for sharing that with me. Like, tell me about you. And why do you know that about yourself and that sort of thing. So it's like people in general, there are a lot of us and we are very, very individual. But anyway, I just wanted to kind of put that out there too.
That's absolutely huge. And you're right. There are ways that this very, very much can be a, a significant disability in someone's life. And you bring up the work that this is on caregivers. So let's maybe shift gear to that and talk a bit more about the journey for caregivers. What are some tips and advice and knowledge that you have to share for those individuals?
Oh my gosh. I mean, I have seen some caregivers out there in the world that I count as my personal heroes because of the dedication that they have to not only supporting their own family members' journey, but to getting involved in the community and, sharing their wealth of knowledge because maybe they're 2 or 3 steps ahead on their journey and they can share something that is just so valuable to somebody who's just coming up and following in, some pretty heavy footsteps. So, I think that it's really important for a caregiver to be able to pull a support team around them so they can be their child's parent, not only their child's caregiver, right? So it's, if it's possible, and this is coming from a very privileged perspective, because of course there are going to be people that are living quite rurally that don't have access to, a community like some of the folks that I've seen that have been so lucky to. But I'd say if you can, as a caregiver, if you're starting on your journey and you just have had maybe your child diagnosed with autism, reach out to your community connections. And whether that's a chapter of, a local patient advocacy group, whether it is, your special education team at your school, find the people that you feel connected to and recruit those people to be your community. And then, share that with the next people that are coming up behind you. Like I said, it's been amazing for me to see caregivers who have such a wealth of knowledge become, kind of leaders in the community. But a few things that I would specifically say as a caregiver, if you're having your, maybe first diagnosis of a child who is diagnosed with autism, is I'm going to go back to something I said first, which is if you're in the early intervention space, you want to know what are the early intervention services in my state. So in California, they're the regional centers. Those are your early intervention providers. They're state by state called something usually different, but early intervention is a term that is in all 50 states. And then you also want to identify your educational resources, right? So you want those two things firmly in place. And then something that is huge that I can't say enough is find a primary care physician that you love if you can, because that person is going to be able to kind of be that hub that sends out those, spokes, because a lot of, folks will need like a GI specialist. They might need a neurologist. They might need, right? Like the list goes on and on. They might need a mental health professional. And your primary care physician, I've worked with some here in my practice, again, that are rock stars, and they have helped so many families, and they have been that primary point of contact for, literally the child's whole life until, they're needed to pass on to, not a pediatrician, but another, point of care. So that's, I think, a few beginning tips that I would give. I'm going to pause because I saw another question or comment come up in the chat.
No, Vanessa's been sharing some wonderful links to some resources. It looks like they're specifically Washington and Seattle based, but there are organizations like these nationwide. So that's really wonderful. So thank you so much for sharing that, Vanessa. I really appreciate that.
Yeah, that's so awesome, Vanessa. And this is exactly what I'm talking about, right? Like you really want to find um, those resources in your community that have, the medical piece covered and the educational piece covered and the community piece covered. These different alliances and patient advocacy groups are a wealth of knowledge. And I can't tell enough. There's controversy between and among some of the advocacy groups that are nationwide, and that's okay. What I say to people is if you find for you a chapter or a society or a system of support that is helpful for you individually, it's the rest of it can just all be noise. You can just be like, you know what, okay, I get the controversy over here, but like this is really helpful for me and my family, and then you pursue that and it's okay. um and I see some, thank you, Vanessa, for nodding, because I know there are folks here that have a lot of experience as well, and we hear it. We understand that there are different points of view and different perspectives. But what it comes down to for a caregiver and their family is finding the support that works for them, and really taking hold of that, because it can be lifelong, right? So we see people like I have seen, I'm just thinking of one particular student who I knew at the diagnosis. He was diagnosed early, which was wonderful. And now he's an adult. And I have seen the whole journey, and it has, been one way one day, and then, oh, this thing pops up, and it's like, oh, okay, now we need to address this. And getting those supports in early and often are what it takes to kind of create this continuum of care. And he is still accessing supports. Like I said, once you're a regional center client in California, you're a regional center client for life. And so then as an adult, you can come back and say, hey, like I'm, needing funds, for example, to pursue this avenue of care. And, in California, there's something called self-determination funds that parents and families can use to then access supports that are now relevant for this person as an adult. So it really is about, no matter when you get the diagnosis, finding those supports and then keeping in touch with them, keeping in touch with them. Yeah. Melinda.
So you're as always, we're covering so much here. And as we're getting a little bit closer to time, as you mentioned, a lot of this are co-occurrent aspects. This is an incredibly complex aspect of someone's life. So as advocates, what are things that we can do to help these caregivers, to help our patients, our clients? I know one thing that you and I talked about is like knowing rights and knowing what we can ask for and what not. But can you speak to how we can be better advocates for the autistic population?
Sure. I mean, I think that that's a very important point that you just made, which is, help parents to know what their rights are as, if you're thinking about the educational setting. And, Vanessa, I'm sure you know a lot about this as well. Like help parents know when they're trying to establish, maybe an individual education plan, an IEP, what do they have the right to ask for? What, how do they get the services that they need written into that document so that their child gets the best possible support across, their educational journey? Same thing goes in a medical setting. What do I have the right to ask for? And, how do I make sure that I can get it? Melinda mentioned something that is, I think, for us to keep in mind as advocates, very important. This is a really complicated, complex part of somebody's life and part of the caregiver's life. So as an advocate, I think something that you can do is ask the family, like, what are maybe the top 3 priorities that you're thinking about right now? Because usually, even if it's a really complicated very multifaceted, situation that they find themselves in, there's going to be maybe three things that are top of mind because they know that if they could get a handle on, these three things, their quality of life would be improved, right? So maybe it's like a parent comes to you and they're like, the one thing that I need to get a handle on right now is sleep. None of us are sleeping. That's huge, right? So then, okay, let's tackle that one piece right now because you can always tackle the 865,000 other pieces, but then everybody's overwhelmed and everybody's running around in circles, right? So I think kind of, when I think about it from my perspective as an OT, it's like task analysis, right? It's like, okay, there's this giant task and underneath it are 700 other tasks. But let's find out from the parent perspective, the caregiver perspective, if the person themselves can't tell you, give me one or two things that are really significantly impacting your day to day right now, and let's focus on that. And sleep comes to mind because sleep is a huge one for autistic people. Their sleep can be pretty disrupted, and especially in early childhood with all of the sensory differences that go along with an autism diagnosis, sleep can be a big challenge. And you might observe something for a family and think, gosh, this seems like it would be really hard for them. And then they might tell you something totally different. Like an example for me might be like picky eating, where you see like the child is not eating very many foods. And you're like, gosh, that must be hard because they can't sit down as a family and like eat all together. And for some families, that is really hard. And for other families, they're like, that's the least of my concerns. I'm feeding this kid the three things that they'll eat. Here's my real concern over here. So again, it's about listening, being super active in your listening and asking curious questions, right? What can I help you with? Tell me the three things that you're thinking about every single day that you can't get off your mind. And then, collaborate on one of those and then pull in the people from that care support team or help the person if they haven't found a sleep specialist. Do some research and say, hey, I found a few doctors. I found a few, therapists. I found a few techniques. Like, what do you want to choose? Here's a list. Like, let's, prioritize this list together. So that's something that, I think of in terms of advocating.
And one thing that I've learned when working, especially with adults, if when they can tell you, listen, as you said, actively listen. What are their priorities? It's not always about what my priorities are. And we do this as advocates all the time, right? It's not about us, it's about the person that we're working with. But I know in the adults that I've worked with, sometimes people are just like, oh, so how can I help you? What do you need? And that's such an overwhelming abstract question that can cause someone to shut down. So I've learned, based on what they've told me in the past, based on previous experiences, I give options. So three things that come to mind are this, this, and this, and it gives concrete, manageable options. And if they say no, none of that, I'm like, okay, great. And I either go to my next three, or I can say, so these things aren't what you need. Does that give you any idea of what might be? And so we've narrowed the scope a little bit. And they're like, well, I really needed something like this. Okay, great. I can work with that. Let's get you those resources. So when we can work with the patients individually and hear out what they need, I think that's an additional kind of piece to keep in mind. Scott had another question. What about financial component? Is there money available for middle to lower class families? Any idea on the financial sides of things?
Huge. Yeah, finances are huge for this group of humans, regardless of really status in terms of, middle and lower class, because this gets expensive and it gets expensive really, really quickly. So, of course, you're going to want to leverage your medical insurance if you have it. And if you're not, connected through, private healthcare insurance, then you're definitely going to want to lean into your funding at a government level, right? So kids should be eligible for, in California, we call it Medi-Cal. every other state for, Medicaid has a different name. So that's something that, definitely people want to look into. When you ask what it's for, it can be for like a lot of different things. People will put, people will go to their state Medicaid office and ask for waivers to be able to access certain services. And that is a talk in and of itself. You can certainly, again, Regional Center is that's a state funded program here in California, and there are funds for families through the Regional Center. Later on, kind of once the plan of care is established, if a family needs or desires another set of interventions, there are funds, sometimes called self-determination funds, that families can apply for and leverage through, their state programs. Scott, it's a super complicated topic that I always outsource to people that know better than me in terms of funding. And then, of course, when it comes to education, you really want to think about, accessing your public education services, because, if your child, for example, is in a public school and you feel like that public school cannot meet that child's needs, families often look for placements outside of a public school campus, like a non-public school type of setting that, if it is determined that that child's need is better met in a specialized setting, then the school district may fund that portion of the child's education, maybe. So again, there's a lot to the finances piece, but those are a couple of components.
And one thing to add, I mean, thinking about the finances, and it has to be mentioned how expensive and lengthy getting a diagnosis can be. So I know the college students that I typically work with, I have such a variety of students that don't have access to getting a diagnosis. And so while we are seeing the numbers on the rise, it's because there has been greater increase in ability to get diagnosis, but the process is lengthy. As you said, it's very complex to get a diagnosis, and it's incredibly expensive. And to my understanding, not all insurances will cover it. So it's, understanding access to this care, access to getting these diagnoses is it's a challenge for a lot of people. So while we think we know how many people are experiencing these these experiences, it's a better word I can't find. There's even more. And so that's really one of the reasons that as an advocate, anytime I'm seeing any of these symptoms, any of these signs, I just kind of immediately open my mind to like, okay, what kind of care can I give this person, diagnosis or not? You are needing a little bit of assistance in this. What can I do? So with that and the last little bit, we do have one more comment.
Oh, I am commenting
Sheila.
right now.
Yeah.
Okay.
So Sheila says, depending on your child's level of autism, they
Oh,
may qualify for Katie Beckett's Medicare waiver, which will help pay for medical services in Georgia. Or in Georgia, they have family support services and funding, which pays for things like recreational supports, uh, DME. I apologize, I don't know what that is.
durable medical equipment.
Thank you.
Welcome.
So it looks like there are some
Yeah.
pretty great programs kind of nationwide, maybe just
Yeah,
looking
this is
at
what the
state.
Medicaid waiver that I alluded to earlier. I'm really glad that Sheila, thanks for chiming in, because I think what I said was Medicaid waivers that cover various things, right? Like I don't even know what all the Medicaid waivers cover, but this is something that, I know that there are like courses that people can take in some of our support, like support for families that I just put in the chat, is an organization that I've seen like, hey, do you need to know about Medicaid waivers? Come and we'll tell you all about them, because it is a whole topic in and of itself. And families don't know necessarily that they have access to these types of programs through Medicaid. And so, yeah, the financial component is very complicated. And I'm super glad that folks put some examples in the chat. So thank you for that.
All right, we've got a few more minutes,
Yeah.
so we can grab it. Any additional different uh, comments and questions if you have them. In the meantime, what are some additional final thoughts and pieces of advice that you have, Lonnie?
I mean, gosh, it just, as an occupational therapist and, having had the enormous privilege of working with children who then grow up, what do you know? They grow up. I've seen so many beautiful stories of success from every kind of level of support need there is in autism. So, I think, my advice would be as an advocate, as a parent, you know, stay the course and recognize the strengths of, the individual that you're working with and really leverage those strengths and those areas of interest to kind of bring that person lovingly along that journey. Again, I've seen so many children at every level of support achieve success in some area of their life with the support of family, with the support of a wonderful teacher or mentor or a wonderful advocate. Um, I just, it just, it's like I'm verklempt. It is a wonderful journey. It is a tough journey. Stay the course, bring your community, rally your community around you. And I'm here for questions for this community anytime. So please, come to me if there's anything that I can do to support you. And thank you for being here today. There's so much more we could talk about.
I think we're gonna have to do another session.
Yeah.
Um, yeah, I thank you so much for the work that you're doing, for the time that you shared with us. Thank you all for being here and asking these great questions. There, like we said, there's so much to all of this, and we didn't get to everything that we had originally talked about. But with time, we'll just say thank you all so much for this. Please let us know if there's additional aspects. We'll be sending out a survey soon, and that would be a great place if there are specific areas that you would like us to cover in another community conversation or potentially an X Center. Just let us know. And again, thank you all so much. And Lonnie, thank you, thank you, thank you.
You're so welcome. I'd love to just invite folks. I'm putting an email in the chat for you to use. I see a question about specifics to SF Bay Area, and I'd love to invite you to follow up with me via email so I can send some resources to you. So here it is. Go ahead and grab that email and reach out if I can be of assistance.
All right. Thank you
Thank you,
all so much.
everyone.